Well, good evening. Thank you for watching Denver 7 News at 6 tonight. I'm Shannon Ogden.
And I'm Jessica Porter. Some of Colorado's largest hospitals have been making record profits for years, and they're doing it all off your dime.
And it's detailed in a new state report, and hospitals tonight are firing back.
So tonight, we're going 360, looking in depth at what the report says and why the Colorado Hospital Association says the numbers aren't accurate.
Also, why the state believes these record profits prove that Colorado hospitals could charge less. Here's Denver 7's Megan Lopez.
When Governor Polis addressed lawmakers this week at the annual State of the State address, he had some sharp words for the healthcare industry.
Some large hospital systems are making record profits, paying zero taxes, and sitting on enormous reserves derived from overcharging customers.
Those barbs concluded with a call on legislators to step up.
It's time that we hold them accountable.
The governor's speech was quickly followed by the release of a series of reports from the Department of Healthcare Policy and Finance, known as HCPF. The reports paint a rosy financial picture for hospitals in the state.
What we've seen is an increase in net patient revenues, a decrease in expenses, with a net increase in profits through that mid-2021.
They show total profits were 26.1% at UC Health in 2021.
We are saying to the big systems, do not raise your prices to protect those profits. Keep your prices the same.
But the Colorado Hospital Association says that data doesn't tell the full story, particularly in more recent years.
Hospitals have lost a huge amount of money since the pandemic. Almost $2 billion through August of 22.
Jeff Tiemann says hospitals are facing the same economic challenges as everyone else after the pandemic.
Expenses for Colorado hospitals are 21% higher than they were before the pandemic. Expenses for staffing are up more than 26% since the pandemic. Medical supply costs are up.
Take Denver Health, for instance.
We are an industry under a lot of pressure right now.
While CEO Donna Lynn says the hospital is unique from others because it treats a lot of uninsured and Medicaid patients, COVID has made tough financial situations at all hospitals even more challenging.
We couldn't do elective procedures for a period of time, and it's been hard to recruit nurses and many other professionals into the hospitals.
To make up for that, hospitals have had to resort to contract labor, paying people like traveling nurses premiums to work for them on a temporary basis. So all of this means
we actually, in 2022, the year that just ended, we will lose money.
HCPF says, though, Colorado hospitals receive more than $1 billion from the federal government to help with COVID, and they have billions in rainy day funds. A lot of hospital losses also came from a downturn in the stock market. UC Health lost nearly $200 million in investments, while Colorado Children's Hospital lost nearly $180 million. So the way HCPF sees it,
the two biggest issues that we're talking about are temporary. Don't worry so much about reserves and market share. Worry about taking care of people.
But again, Tiemann says that's not the full picture.
I am out there every day hearing the stories of hospitals, and I know they are up against it.
And his bottom line?
Hospitals stepped up in such an amazing way during the pandemic. We have a strong hospital system, and we want to keep it that way.
This tit for tat over profits ultimately comes down to data, and more importantly, who is interpreting it. Megan Lopez, Denver 7.
Looking deeper tonight, almost all of the hospital systems in Colorado are not for profit. Now, that does not mean they don't earn revenue, just that they aren't taxed on it. So here's how it works. Not-for-profit hospitals have to dedicate a certain amount of funds to what the state calls community benefit programs. From 2014 to 2021, the state says not-for-profit hospitals made $965 million in community investments in lieu of paying taxes. Now, it's important to note the state does not currently have specific requirements on how those investments are spent. Instead, Colorado encourages hospitals to put the money towards lowering costs, increasing access to services, and mental health care.
UC Health, for example, we see that nearly half of their community investment is going to support the CU School of Medicine and professional education. But when we look at what their community has voiced, that is not what the alignment is. The community is voicing need for mental health care, access to services, and supports for employment and education for the community. We should be looking at really examining, is the value of that community benefit really meeting what the value would be with taxes?
The Colorado Hospital Association says healthcare providers are making important investments in the community with the funds, and they are justified to have those tax exemptions. The hospital profit debate could be a hot topic for lawmakers this year. If the debate inspires any new bills to pop up this legislative session, we'll keep you updated.